translation. Si alguien necesita traducción, tenemos traducción. Gracias, Margarita Fisco, que está ayudando con la traducción. Podemos seleccionar interpretación. Hay un globo en tu, ¿cómo se dice? En el menú. Podemos seleccionar si necesitamos traducción en español. Se puede seleccionar el canal. ¿Sí? Todos sabemos cómo seleccionar. Does everyone know how to select the translation service? Yes? Anybody not? No? Okay, thank you. So we're going to start, first of all, by really welcoming all of you and thanking Lucia and thanking Zafira, who is our intern, for all the help that she has given to put together some wonderful video to help us illustrate this very amazing journey that Lucia has brought us on with Quest Center for Integrative Health. And for those who don't know, this is one of our senior Susila Dharma project members of our network, one that we learn a lot from. I believe Quest Center started in 1989. I'm sure Lucia will correct me if I'm wrong, but it was Lucas Harris and Lucia who started the center as a psychosocial support center for people living with HIV/AIDS. And it was courageous then, and it's still courageous today, because since then they've gone in many directions, offering services to many diverse clientele. And it's so exciting to see such a solid project socially, in terms of health, in terms of a model that really meets the needs of people in the community. So I want to turn it over to Lucia, and we're going to ask people when they can to speak slowly for the interpretation, but we really welcome Lucia and thank you. Thank you. Please take us on this passport journey to Portland, Oregon.
Can I just ask people to put themselves on mute when they are not talking? Thank you very much. Otherwise, I might mute you just because to get rid of the background noise. Sorry, go ahead, Lucia.
Thank you. Excuse me, as we begin, I want to say that, you know, today in the United States is the 9/11, which was a very powerful time, and probably everyone from the United States remembers the moment that they heard of the terrorist attacks. And so it's the 20th year. And so it has me think about how important the things that we do and bringing into the world projects are, from a spiritual way, just what the world needs. And I appreciate so much every person that's here. And from Quest, we have Wendy Neal, who you'll see in the video, who is an osteopathic physician and has been with Quest for over 20 years, and she is a naturopathic physician also. We have Kara Edge, who is a mental health therapist, and Padine Quinn, who's a naturopath, who are all in attendance. And so we have Sam Lee, who has been an intern at Quest, and various people who've been on boards and have supported us through the years. So I want to welcome everybody and my gratitude that we exist. And one of the things I want to say at the outset is that I'd say part of our mission is the belief that in the United States and in many places, people get way too much into their individual way of being and lose a sense of trust and community connection. I see that one of our very important parts of our mission is that as people are going through crises or seeking to live in a wellness way, the value and importance of community. And some of that, certainly in my life, has come about from being in Subud and feeling that, like, say, with Susila Dharma, that Quest is a part of a community that I know thinks of us, knows about us, helps us financially, and just brings their prayers and support present. And it's one of the things that has allowed me to stay and to want, even at my age, to continue in a very active role in work that I love. So I want to thank everybody, from the deepest place in my heart and being, for all the support. And I also really want to make sure I also acknowledge Zafira, who interviewed different people and really helped put together a presentation that was useful to me to kind of review all the years and the meaning of being a Susila Dharma project. And the other thing I want to say is that we have become, from a very tiny project of Lucas and I and a dream, to a project where we have 73 employees and we have a budget of, I'm not good with the funds, but we have people who are, I think of like $5 million or something like that a year, because we have 73 employees and rent and all of that. But it is, it's just so important that we're all in it together, that we put things together and continue sharing. So I'm going to turn it over to whoever's going to show the video. And I think we're going to have the video, have some pauses, and then have times for people for questions. And do feel free to ask some of the other people from Quest questions too. Thank you.
Thank you, Lucia. Zafira, you can go ahead and share the screen now.
Okay.
Thank you.
Does everyone see?
Yes.
Okay, so I'm going to start the video.
Great.
When I first came to Portland last December, I was just in a really hard place, just very dark and isolated, and not knowing what to do or how to move forward. I was alone, like I was alone. Then we were on the verge of homelessness, or homeless a few times, and just being low income, just addiction issues, single parent, trauma, just a lot.
I'm a survivor of childhood sexual abuse. I contracted HIV, and that's where I really started to just explore the world of illicit drugs. I don't know if I really want to stay around for this, and really contemplated ending it.
When I was a child, I was a member of the LDS church, and realized that I was gay. If the church didn't accept me, how's the gay community going to accept me? And so when the drugs came along, I didn't care if I fit in. That's what I've been doing the last 5.5 months, is working on recovery. And it was done. I was done.
Quest was like a lifeline. Suddenly I had things that I could do, ways that I felt like I could help myself to keep moving forward. It's just like this world opened up. It's like, have you heard of Quest? Quest has yoga and acupuncture. I'm like, what's Quest? What? No way. I mean, it was all kind of surprising, all the things that were available.
They hook you. You go in for one thing and then you hear, oh, they do this, they do this too.
Opening up to the uniqueness of each individual person and how it's going to look exactly your own way every time. And the more space there is for that, the more potential there is for the growth and the healing.
They really want you to experience life, not just going to treatment.
I love that sense of community that's being built. That's very new to me, where like I can walk in and have people that know me, that are smiling to see me, and I want to be with. And I love nutrition. I love helping out with it.
Companionship just community talking. Why I like it so much. Because it reminds me of my grandma's cooking, because she'd always cook for the family, and then watching her face glow with watching us enjoy it.
There's no place like this place. There really isn't.
It's really powerful to feel so like taken care of, and yeah, valued is a good word for it.
This is a family here. It's not just a business, but it's a family.
Feeling this shift, and I just see how everything has come together to keep me moving forward, to enter into this new stage in my life, and how Quest has been like such a key piece in that.
You know, going from a little gay boy in an LDS church, not fitting into a community that accepts me for who I am, is a big deal for me.
Today, because I'm integrated and feeling my feelings, I can actually feel love.
People say like a life beyond their wildest dreams, and it's like my life isn't quite there yet, but my life is getting there. It's like I never thought, I could do a lot of the stuff I'm doing. So they just provide so much to create my own story, supporting me in my journey, not to make it a certain way, but to meet me where I'm at. So I have all of these things that I can take and utilize to create this beautiful thing for myself.
Because one of the most fundamental things is that when I think I can speak for a lot of my peers, are here, we don't feel like we're being pathologized. I don't feel like I'm a patient. I don't feel like I'm sick, that I'm going to my place to fix me. I feel like a member of the community coming to see my friends, and coming to see not my doctors and not my keepers and not my judgers and not my, my gods, which dictate my health. I am seeing people who co-create my health with me.
I had a dream, and the dream was a very powerful dream in which I dreamed about Lucas, and I dreamed a dream about some changes that were important for him and his healing. There should be a healing center, and that Lucas and I should form this healing center, and that it should be done now, if at all possible, because there was a need for it. And again, I got the part, if I was willing. I didn't have to do it, but if I was willing, it would be a good thing. So after I had the dream, I thought about it, and I thought about telling Lucas the dream. And I thought, well, I'll tell him the part about his own healing and about having dreamed about a healing center. So he came up to me in the morning and he said, Lucia, I had a dream. And you were in it, and you're not going to believe it. And so he began to tell me the dream. And the dream had the part about the healing that he needed to do as I had dreamed it. And then he said, and I dreamed about a healing center and the importance of creating a healing center. And I'm thinking, oh my, that's a big dream.
I'm an osteopathic and naturopathic physician, and I started officially with Quest in 2000, and we've been meeting in living rooms with Lucia and some of the other original Quest people and a lot of other people trying to create an integrative practice for a couple of years before then on Sunday afternoons. And I do body work, hands-on osteopathic manipulative treatment, a lot of cranial work, but I also have training in group therapy. And so I co-lead a lot of groups and retreats with Lucia and with other folks at Quest. Quest is different from the other models of integrative clinics that I've seen. I've worked in hospital systems and on an Indian reservation and in different integrative offices, but we are really committed to having it be a center where everyone works together instead of independent practitioners in there, and really having people work on a collaborative basis, support each other, and develop programs together and independently. And we also really, we give a very high level of care. In terms of expectations, we have a lot of grants where we have to follow certain parameters and we have to prove that we're giving high quality of care, but even people outside of those models, and each different practitioner is really dedicated to giving the best care that they can. And whether it's a mental health person or a peer mentor or a physician, it's just like in some clinics it's easy to kind of slide a little bit and say, it's more important that we look at this aspect, and I'm not so worried about these other more technical or clinical aspects or whatever it might be. But everyone there is just so dedicated to really making sure that everything's done in a really good and sound way, if that makes sense. One of the things that I love the most about Quest is that we do offer different approaches. And so we offer naturopathic medicine, which I'm also a naturopath, and I work with some wonderful people who can provide herbs and talk about diet and things like that can support people's healthcare. We have a lot of Chinese medicine folks there, and that is really fundamental for our program. We also have a pain program to help people with chronic pain. We have a program for people who are dealing with addictions. And our biggest program, and we have an HIV program that is carried through forever. We have so many HIV positive folks and a lot of GLBTQ folks. And so really creating programs that are unique to their needs. And then the mental health team is the biggest team we have, and just a lot of really fundamental mental health care and options for people.
When you have a wellness focus, it's a very different thing. It's always looking at and believing that people have the capacity for wellness with whatever illness that you have. And that wellness relates to how do I show up today in the fullest way, and how do I receive the guidances to experience this illness and all that I can do to heal, either into living or into dying. So in a wellness focused healthcare center, we're not just working, say, in our alcohol and drug treatment program for a person to be clean and sober, so to speak. We want for them to be that, but we want for them to really feel the shift to being guided within and on a healing path. So that feeling of recovery is something that's profound. It's recovering who you are. I want medicine, or the work that I do, to move from a model where I look at a person by the disease they have to looking at a person by the health and wellness that is within them and can come through, and that by being present with them, feeling the spirit within my own self and creating that atmosphere and belief. And then when you have others that feel that and believe that too, it really supports people being on a healing path and life being able to be lived more fully. And I'd say living life fully is one of the things we hope at Quest to inspire and support.
So I think that being at Quest Center is unique from other clinics and places that I've practiced, because it really is founded on a principle of allowing that sense of spirituality to come through in everything that we do, to whatever extent it feels right, to and in different ways with different patients, and each practitioner is unique in that sense. I feel that when I'm with a patient, I am able to connect with them at a really deep level, and really there's a sense of connecting at a soul level, a spirit level, a heart level often, or if someone, it depends on what the patient is asking for and looking for that day. But I feel that Quest is a place where my spirituality can be an active participant or an active part of the field. And I feel like each of us who work there are really committed to the same thing. I wouldn't say that everybody comes in thinking I'm going to bring my spirituality to it, but I think that because there is this groundwork of really caring for and seeing the patient as part of a greater whole and in a different context, I think there's a spiritual aspect to what we do on a daily basis and on a moment-to-moment basis. It's not that we don't have our challenges and conflicts, because those are part of everything that anyone does, right? And especially being in a group, the more people we have there and the more things that are going on, the more things that come up. But just having that commitment to working from a spiritual place and to finding deeper meaning and deeper connection really flavors what I do. And Lucia's founded Quest from that place, and it's really carried through. And I think it's been a huge part of what's kept me there.
One other thing that through the years of time, there certainly have been a number of people who have come to Subud, and it is really gratifying to sense that too, that I believe every person has the spirit within and can feel that awakening in whatever way it happens. But it is really nice to have people who join us in our Subud community. It has also been interesting because since we work a lot also with the gay community, certainly we are probably the Subud group that has the most gay people, and learning how to have that be a part of who we are as a Subud community, and making room for more diverse ways of being and presenting, I think is key to what all of us need to do. And it is actually part of my receiving that is a role that I have, is helping there be more openness and a greater sense of love for how each of us comes into this world, and a love for the LGBTQ folks and all people. So I see that as being an important part of what I've received to do in the Subud world too.
For me, it's completely up to the patient, the person, and where they're at and what they want and how they want to be supported in that. Some people just want to come to the clinic and have a place where they can come and be supported in terms of treatment, physical treatment that helps them feel better in their bodies. And some people need and want more of a wraparound care. We've had a lot of groups to support people, and really working with people to support their physical, emotional, and spiritual beings. And then I've done, as people get more depleted and need more home care, I've done a lot of home visits and really helped create an environment in their home or wherever they're at where they can really feel supported. And to me, that's such an important time in people's lives for the patient and the person, calling them patients, but for them and their families, it's just such an important time, helping them find whatever they need to hopefully be at more peace and make that transition more easily, and in whatever way feels right to them. It's such a unique thing for each different person.
Our culture is not one in the United States that I believe deals with death very much. It's kind of like a problem, not something that is a natural part of living. And I think because Quest has a wellness focus, it's looking at death as a part of life, and that to trust that within each of us, we have the capacity, as we do as a child, grow and learn how to walk and talk, that there's the capacity when we're at another time, when we're dying, to be able to have the shifts and changes that are naturally there that support a transition. And that by having people around when a person is dying, and we have done some times of being with people dying together. In the early days of Quest, over 40 of our people died, and it was a community time where people would choose who would be present and how to be there. And I'm thinking of a death of a woman with cancer that Wendy and our naturopath and I and some community members were present. And this person made the statement that it was actually the best day of her life. She felt the most loved. And she was a person who'd really struggled and to stay out of being homeless, etc. And that beautiful feeling, we're in this together. This is a spiritual event, as every day of life is, but even in a bigger way. And I felt so moved by helping this woman have this transition. I believe much more that my death will be something that I can do in a peaceful and loving way, and having been with many people who I have experienced that with. In the last 5 years, I had the experience where somebody had called me, actually from Missouri, and that's in the middle west of the United States, and a fairly conservative area. And a person was wanting very much to learn more about supporting the process of death and dying. And so a woman and her mother talked to me for some time, and I stated that I'd be glad to talk with them and give them some guidance and support along the way in this dying process that the mother was going through. She was in her late 80s and had been very much an activist and a very special person. I actually never met Edna, the daughter, or Claiborne, the mother, but they were wonderful people that I supported through a process until the mother did pass away. And I did it because I received it was the right thing to do, to have these conversations. It was never a build for thing. It was just a thing as a human being asked to help people in a trying time and kind of prepare for dying. And 2 or 3 months after the death of Claiborne, her daughter contacted Quest and talked to our director, David, and I, and gave a donation of $250,000. I had no idea that they had any money at all, of course. It was something I received to do. And that money was incredibly helpful in helping us get through the pandemic, because we were going to have to lay off a number of people, and it was just going to be challenging to be able to keep our organization running. But I would say, being with Quest for a long time, there are miracles. Actually, every person is a miracle. But then there are those miracles that happen that you just know there's more to this when you trust, when you believe, when you put your heart into it and say, I'm here.
So, Lucia, I think we'd like to open it up to any questions that people have at this point. If there's any comments, any sharing, it's really nice to have Michelle here from Ecuador, who is a nutritionist, and people who might have questions or give some kind of response. I personally would like to kind of kick off, because we're struggling with this pandemic and COVID-19. And I would like to ask the practitioners, Wendy and Lucia, what are you seeing now at Quest Center? You've built Quest very much on dealing with one health pandemic, which is HIV/AIDS. How are you seeing people now? Is your clientele struggling with this? Are you learning or seeing any parallels with what you've been through in the past? Maybe you could just comment on that a little bit.
I guess I'll begin. I certainly do see parallels in being in a pandemic where there's just uncertainty and not knowing what's going to happen or who's going to be sick. The sense again of how important community is, and yet how much fear and all the different unknownness makes it hard, makes community very, very important, and finding how to do our services and how to support and care for one another. It is hard in times like this where all of our staff are in the pandemic also, with the same fears as the folks who are coming in. And I believe the commitment to provide services and to show up for each other and to find different ways. We've taken this year to really also focus on diversity, inclusion, and how important equity and justice are for all people, and to have that be something we look at as we go through the pandemic and as we try to open in a bigger way, and to trust. What would you say, Wendy?
I'm one of the few people who has been working on site full time with patients, and so much of our staff has had to do things virtually that's been such a big difference in terms of having to establish community amongst ourselves in different ways and be really conscious about that. And then also being, as Lucia said, being so conscious of clients and how isolated they feel and how all the fear, and us just being with a person one-on-one as close as we are in providing physical medicine services. And, that's got its own, like, how do you really be with somebody and wear all the PPE and things? Maybe even a face mask and things. And then you can just feel the patient's need to really be with people and be touched in at all levels. And it's so huge right now, and helping the isolation. Lucia and I are used to doing retreats 2 or 3 or 4 times a year at the coast for a weekend, and we haven't been able to do that. So we've had some Zooms where we try to bring people into community. We've had really, I was thinking of the people who've died during the pandemic and trying to have memorial services for them, not necessarily from COVID, but from all different causes, but people who are really tight in the community that we did retreats with and things. And that's been so touching, trying to figure out how to really honor them and yet not being able to be together physically, or sometimes finding a way to be together in someone's backyard in a safe way. So yeah, it does feel like there's a lot of need out there. And I know the mental health folks and Padina, our naturopath here, they're all working really on a deep level, trying to support people with all of those emotional and spiritual needs, as well as the physical needs.
Thank you.
We also turned our nutrition program into a time of giving as much food as we can, with our wonderful person, Heidi, who heads that program, getting, for a number of people, food that's delivered that will serve their specific needs, whether it's being gluten-free or needing particular items, so that people can continue in a healthier way. And SDUSA has certainly helped support that program now and through the years. So
Thank you.
Our nutrition program, every Thursday night, we would have 30 to 40 people come together, and lots of practitioners, but mostly people from all the different communities that we serve. And that was such an important social time for people to be together. And we haven't been able to do that at all in the last year and a half, I guess. And so trying to find creative ways where people can have something like that, way they can touch each other in our groups, really trying to provide that as much as we can virtually is challenging. But
Thank you. Thank you. Do we have any other questions before we continue? I know there's another part of this presentation coming, but if anyone has any questions right now, please feel free to ask them. Liza.
Thank you. So moving. It's funny, I haven't revisited your program in some time. I'm immersed in my own work, and it's so important. I just realized how important it is to come back to see just how incredible the work of Quest is. It's just so moved. Lucia, I'm wondering, in Portland, we've been kind of the hotbed of clashes between extremist views, and I'm wondering if you see any role or of how that's impacting your practice. I'm thinking of we have the Proud Boys and the Antifas, and it's been a very difficult climate here in Portland, and we have a lot of homelessness, and I think we're just kind of we see so much of what's the crises in the world. We have a bubble here that really kind of, we see so much of that. How do you guys have any changes or any thoughts about how to maybe address any of that?
I would say, Liza, that in a time like now where so many people are affected, and we have, a wide variety of folks we see, and some of them live in areas where a lot of folks are without houses and can be in challenging situations, and folks who don't feel safe, with all that's going on. And I believe that sense within each of us, in our community of folks who work at Quest and in the programs that we do, bringing a sense of grounding and spirituality present, that we all have to stick together. We all have to do our diversity and inclusion work. So we begin to look at how to create a more loving world, and that Quest can stand for that. And we need to be the people who help that to come through. So I certainly feel it as I'm with people on Zoom calls, and some people have had some interactions that have been really scary and violent around some of the protests that have occurred. And helping people, again, not give up or shut down, but feel like you're a part of something, and let's work together to help the world be a safer place.
Thank you, Lucia. Michelle, you have a question?
Well, I have a comment or a request, perhaps. First of all, I just wanted to thank you. Thank you so much for showing how your spirituality, how you're living it within your professions, and how you're able to create such a community with so much diversity. Here in Ecuador, our project, I guess my request is that somehow, with all of the support of all of you wonderful people, we're able to do it much more from a spiritual point of view. Because we have the other things kind of in order, not with the resources we need. And that idea of working, assuming the miracles will happen, is so difficult within budgeting systems and all of that. So I'm just kind of asking the support, the help, the prayers, that Fuegos will be able to operate from a much more spiritual point of view. And I ask you to all help me in that role.
Thank you. Thank you so much, Michelle. We're definitely praying and for you and thinking about you. And for sure, I mean, Quest is such an amazing model of a human success, of a health success, and also of a sustainability success as an organization to have achieved what it has and done so for so long. Really, it's a model to be looked to and learned from, for sure. Any other questions before? I can't see everyone on my screen. So if there's any other questions, if not, we're going to ask to go back to the video and see some more, learn a bit more about Quest. Zafira, do you want to take us back there?
Yes, of course.
Thank you.
The last 5 years, we also, through David's efforts and others, have established the first LGBTQ focused housing for folks in addiction treatment. And it's just been really a wonderful thing, actually. Many of the people from our Portland, Oregon government came to our opening of this to really celebrate that we are working with communities. We are also, we're asked by the county that we're in to be the supportive system for an African-American specific pain program and alcohol and drug treatment program, because we've been so good at our finances and at our infrastructure, and people trust David's work. So we are working to have a group called Miracles, that is the African-American specific drug and alcohol and pain management program in Portland. Quest has this year purchased a building, so we will have a building that has over 1,000 square feet. I don't know what that is in meters, but it will be able to house all of our programs together. And so I think this will be a year where we really come into being what we've always wanted to be. So I'm very excited and happy that that will be able to happen.
Working to create a specific trans program. We have several people who are trans, but we're really working on creating the funding. Right now we have several big changes with a new electronic record and a new building that we're buying and things, but we also are always working on how do we want to deepen and expand in terms of our programs, and the creating a safe space and programs that are really dedicated to people who are trans is so important, and it's so much a part of what we do, but to be able to do that in a deeper way is really one of our next openings and our next commitments. We have a big commitment to making our services available to folks from all different socioeconomic backgrounds. So it's not just for people who have money. We have a lot of grants, and we really spend a lot of time getting resources so that we can provide it to people who don't have money. Some of our people are temporarily or long-term houseless, and we support them. And anyone, we want to make our services just really available for people and not have it be dependent on who has money, how much insurance do you have. And we have a lot of, we have a sliding scale, payment plans, and we do some services for free if we need to, and we just make it
We have like a six-legged stool. We've got publicly funded dollars in the United States. That's Medicare and Medicaid. Medicare was started in the early 60s, and it was for blind, aged, and disabled people. The following year, Medicaid was set up, and that was for people under a certain poverty level. That under President Obama and the Affordable Care Act was expanded. We don't have universal health insurance like in France. You know, it's all privatized and very, very bad. So we always have to look for creative ways of utilizing those systems to help marginalized people. We then get contracts with municipalities, the county, the city, the state. And then we have grants, and then we have donations. So that those are our major funding sources. There's new money under the Biden regime here, President Biden, that is coming from the federal government, coming down into the state level for housing. And that housing money, I was able to form a coalition of other like-minded organizations, and there's millions and millions of dollars. So in Portland in particular, the cost of housing is obscene. It's very expensive. Most working people can't afford it, let alone non-working people that come from oppressed and marginalized populations definitely can't afford it. So we're looking at coming together as a coalition to get a hold of some of those dollars so that we can create more housing and services around that housing for people who come from LGBTQ plus community that has either substance use or mental health disorders. That means we have to diversify how we can make sure that the people that need it the most can get in to see us. And that's the Medicaid and Medicare folks. They're the people that have the least amount of resources. And it's actually closer to 80% of the people. We do have contracts with different insurance agents, insurance companies for people that have money, but it's not really our mission. You know, our mission is to serve underserved and marginalized folks. However, we like to have a mix so that there is a more, there are different people of different backgrounds and skill sets so that people can interact with different folks. We have very dedicated people, very dedicated staff that work very hard. So when I got to Quest 16 years ago, there were 6 staff people, and now there are 73 staff people, and we are in separate counties, and we just bought a building, and we've expanded I think I might have had a little to do with that. I told them I would only come on for 9 months just to help them out, and now I'm here 16 years later. So before I got there, they needed somebody that understood the different funding mechanisms, was able to marry the community and health aspect with the financial aspect, so that we could develop the programming and make sure we had sustainable resources for it. Before I got there, there was no alcohol and drug program. There was no housing. There was no development. There was no movement, yoga or qigong. There was no pain program. There was one person, who did all of the billing, the office stuff. And now we have a business office of 5. I've always been in public health. I've never been in a private practice. So it was always important for me to understand how am I of service to people that need it the most? And you can't do that on breathing and on goodwill. You've got to be able to pay people. You've got to be able to pay the rent. And so I was able to bring a certain acumen from my previous experience to Quest to bring things together.
I'm Sunrisa Gleason. I live here in Portland, and I've been going to Quest for 5 years now. I was raised in a very strict evangelical Christian household that had a lot of abuse. I didn't have the coping skills. I didn't know how to deal with life. The only way I could get by was the alcohol. I'm a mother. I was ashamed. I was so ashamed and afraid to open up, afraid that somebody was going to take my children, that they were going to judge me, that they wouldn't want to help me. I've been trying to stop for 25 years. If this doesn't work, I don't know if I'm ever going to get clean. So I got sober during a time of COVID. I thought that would be impossible. I thought, oh no, we're in a pandemic. Oh no, this isn't going to be possible for me to do right now. If anybody can hold it together during the pandemic and still provide good services, it's Quest. And they've proven me right. They already built that trust with us. And so even though this is still so new and so ever changing every day, they've created this thing where we still feel as safe and confident in the process as we possibly can. From the moment I walked through the doors, I've always just instantly felt relaxed, like these people care, I don't think I would have tried with if I didn't trust Quest so much after the amount of trust that I'd built with them over the years.
But she kind of went backwards, and so she started with naturopath services, mental health services, and then came to FSR and got all this help throughout them, and then they referred her to us when she thought she was ready to be able to quit.
I have meetings 5 days a week. They still offer 2 times a day. They've managed to virtually provide all the services.
Completely honestly, I've never met her in person. We've been on Zoom this whole time. She started at the time of COVID.
And they've been very upfront and honest with us that, hey, we're human, we're figuring this out.
Because this is new for everyone, right? Just because we're a business or a service doesn't mean we know how to navigate a pandemic, right? So
Quest in response to the pandemic has been very quick in terms of changing around policies, changing around procedures to make sure that client and staff safety are the #1 priority.
And my first initial thought was, it's not just me, we're all going through this.
I feel proud. I feel very proud to be able to work with these individuals and work with my team and work with Quest as a whole, helping people through such a difficult time.
But I also, as a peer, I'm able to text clients, and so I try to stay very interactive with them and let them know what's going on all the time.
We have constant contact. We check on one another.
Maintaining that sense of community in spite of the distance. I believe that's why Quest is thriving during this time of COVID.
I don't see Quest as a job. I see it as a resource, and I see all of us as caring humans doing human work and offering services.
I had clients wishing me happy birthday, clients who I talk to regularly just to check in and see how they're doing. And this is a position that I've always wanted to be a part of, and this is a community that I've always wanted to be a part of.
I don't want to escape from my life anymore. I want to be present in my life. I would see pictures of my friends' gardens and I would just cry because I thought I'm never going to be able to do that again. And I loved that so much. And since getting sober, I've gotten that back. I'm enjoying fresh tomatoes off my plants from the front yard right now. You know, we've all been so busy, and we all see this self-care thing as a luxury that can be put off until we have time. And then we never seem to find the time. And now we have time, and then time to practice self-care and get used to it, because we all need it. We deserve it. And your community and your family deserve you to take care of yourself too, because you're a much better person when you do, I promise.
You're muted, Hamida.
Oh, congratulations again. This is just amazing. And really a lot of thanks to Zafira for pulling together. I think she's pulled together some of this footage for us. It's quite amazing. This is also a time for some questions and going a little deeper with Lucia and her team. Wendy is here, Cara. Interesting that we've already touched on the pandemic and also the issues around sustainability and financial. Wow, you have a really amazing executive director there who's really built the capacity to take on these amazing programs.
When we were really beginning and were poor and didn't have funding, he let us be in the basement of a building that he had. I mean, for $200 a month rent for all utilities included, he supported our program. And so he learned what we did. He learned too about the sense again of the importance of spirituality as a part of all of it and of doing things in an integrative way. So at a later time, he actually approached us and said, I'd like to serve as your executive director to help you become sustainable. And I wanted so much for him to be a part of what people see here, because with all the inspiration and love and things we've done together, you have to find someone who can do the funding and has the resources and the connections and just knows how to make it be so sound that your community calls on you to be the sources because you do that good work. So I'm very grateful that it all, I believe, through spirit came together. So. I think it would be, to hear that I'm saying he through spirit suddenly arrived, but anyway, he did.
I'm sure part of him knows it, but any other questions sorry, go ahead, Lucia.
You just have to have the money, or you can't hire people, and you can't have people who are on your staff treated in a way that helps them be able to have the health care and benefits and things they need. And so you got to have a strong person in that position. I would also say in the beginning, I kept looking for someone in Subud to fill that and tried different things. It was actually very challenging until David received to come and join us. So
it's quite amazing, quite amazing. I'm not seeing any hands. Kendra, you want to say something? No. I want to, yeah, Liza?
Linnell wants to say something.
Yes, go ahead.
I was just going to say.
Will for you.
Oh,
you will then be able to avoid making mistakes and getting into difficulties.
Und wenn ihr diesem Gespür folgen könnt.
Oh, someone's listening to a talk in the background. Hi, Lillian, can I mute you?
Werdet ihr nicht immer wieder.
I'm going to just mute her.
I had two comments. Just when you're talking, Lucia, about drawing from the whole community to make a sustainable project. Really, to me, that is the embodiment of SD work, is that we don't, I think it's one of the wings that is the most like the ripples of the wave of our work going out into the world and being connected and interconnected with people. And I think that really is a great model that keeps us away from being so insulated. I think that's one of our challenges in Subud, is that we become very insulated. And SD to me has always been the one where it really is able to connect and show proof of our Ladihan in the world. And you do it so beautifully. I did have a question. Was curious about the housing project that you're starting. What is your role in the housing project? What does that look like?
The house that we have presently that was spoken about is actually a beautiful house on Burnside in Portland, and has a house manager, has people who are in alcohol and drug treatment and are getting services so they'll know how to be able to get their own place and get employment, which will be the next step. So you do like wraparound services and a sense of support. So anything that we do that way, as you were stating, Liza, we have to be with community partners. And so there's a program called Bridges that does housing. So they actually are very involved in owning the house and property, but it is a house that's part of our center and what we do. And we are looking to do housing that would then allow for a next step for people to maintain clean and sober living for long enough to be able to really create their lives and be back in the world in a way that allows them to be fully present. So it's always collaboration with others.
Great, thank you. Wow.
Lucia. It's so interesting because I think that, again, I keep coming back to this pandemic, this COVID-19 that we have been experiencing, but I think it's so made us all so much more aware of the social barriers to health. And I think that's one thing that I love about Quest, because it's a model of that interaction that is often hard for people to see between the social aspect and the health aspect, the socioeconomic factors, the racial factors, all the factors around sexual orientation, all the factors that marginalize people and put them at greater health risk. And I think often in Canada, we think that we have something to teach the Americans about healthcare, but I think that here the Americans, your team, has something to teach us about holistic health and where the social and the social aspects really, and COVID has shown us how certain categories of workers are much more vulnerable. How, you know, in even in Canada, where we have a social healthcare system, Black population is 9 times more likely to contract the virus for a lot of reasons. So I think that you're really teaching us something incredible, integrating housing, integrating drug and alcohol program, integrating all these dimensions of care. I just want to ask if someone else had their hand up. Someone said, oh, we have Eliana. Do you want to ask a question? Linnell?
Linnell. Yeah, hi. Hi, Lucy. It's very nice to see you. It's wonderful to see you. You make me feel safe right through the Zoom. I wanted to ask, it's hard to put into words. Michelle sort of touched on it. How, from the time you received this dream with Lucas, have there been particular moments of other guidance that was decisive in taking you one direction or another, and how did that come? And how did it feel to be right at the center, the guiding force, the sustaining force, in large part, for this sustainable project that has grown and is inspiring us all immensely? Can you talk about that at all? Do you understand what I'm asking?
I do, and I would say that actually, it is the sense again of trust that there is a wisdom, a knowing, kind of living from that guidance, and a trust that if I follow that, things will turn out. And I ended up living in a basement. I ended up being sued for $9 million. I mean, there are many stories of having to go through things by a drug dealer where I was naive. I mean, there are so many things that it was just always trusting that this, if I listen and follow and connect with my community and get support, this needs to happen. The dream was important in the sense of it being a true receiving, that this was something that could become more available. I wish that it were bigger and stronger and could influence our health system in a greater way, but we have seeds and we put them forth, and a lot of our folks go out and do more. But I'd say trust. Every day I'd say I really receive guidance, and I'm still working at 77 because I love doing what I do. I love doing retreats with Wendy, learning more about sleep from Padine, being with Kara. I mean, all the different people that I'm with inspire me, and I feel spiritually we need this. So thank you.
Thank you. Thank you. Thank you very much.
One other thing that I think is important, which doesn't exactly pertain to what you stated, but that we use peers, and you know, our model in the United States of healthcare can be so hierarchical, and people at the top make a lot of money and people at the bottom are on food stamps. And so the awareness of having folks who have lived experience, who are a part of almost all of our programs, who, as Kim spoke of, and Brian too, in the footage, where they meet people, talk with people, help people believe it's possible to change, and that you have to trust and stay with it. Trust and stay with it. So that's what I'd say.
God bless you. Thank you.
Kara, I'd like to, go ahead. Please share your thoughts.
My internet is a little bit unstable today, so I apologize if it gets choppy. I'm a mental health therapist at Quest, and I just wanted to share a little bit about my experience being at Quest for the last 4 years. I actually came to Quest after a period of time in my life that was very difficult, going through cancer treatment. And my life had kind of fallen apart, and I was just getting back on my feet. And I was just really embraced by the Quest community, and have really gotten back to my own spirituality through that process. And it's been such a gift to be part of this community. And, you know, speaking to the pandemic, you know, we have so many folks who have relied on Quest as their one connection, their one lifeline to the outside world throughout this pandemic. And, you know, being able to offer food and services online. I had one woman who, she likely got COVID early in the pandemic and lives alone in subsidized housing. And I went to take food to her home one day, and she asked if I would walk with her outside, and she began weeping, saying, I haven't been around another person or been outside my apartment for 6 months. And it was such a gift to be able to be present with her and share that moment of breathing in some fresh air and having some human connection. So just a lot of gratitude for this community, and thank you all for being here and your support today.
Thank you, Cara. Thank you. That's really, we're so happy to know all these team members who we wouldn't normally get to meet. And this is the beauty of our SD Passport series, where we get to travel and meet all these amazing people, practitioners in other parts of the world. If there are no other questions, we're going to take the last, oh, Elena, please. You're on mute. Oh, Elena, you're on mute.
Hello. Yeah, sorry.
Eliana.
I think they have already answered my question, because I have been following the enterprises talks or interviews, and they always ask the people who have an enterprise, have you have a mishap? Do you have a difficult time? Did you realize that you made an error? And what is your reaction to it? How did you get back into track or overcome that mishap? That's my question.
Excuse me. Did you understand, Lucia?
I mean, I think it is just the fact that there are lots of mistakes and things that happen along the way. And honestly, I would just say it is asking for guidance around it, taking time to be with others, and doing, you know, testing or asking, may I please receive guidance to understand where I go from here? And, you know, as with so many things, through the mistakes, you know, like even getting sued at one point, I was way too naive, and it was a kind of trust that wasn't discerning. So I lost through that. It was going to be necessary.
This happened to me.
Steps.
This.
The screen's gone all weird.
I can't unmute myself.
Thank you very much. Thank you very much.
Elena, did you want to say something?
Yeah,
No,
I just want to you.
Okay.
It's wonderful to listen to all this. I just love it. Bravo. Fantastic. I don't really have any any comments. I wish I could be more part of it. Being in Toronto, where it's also very needed, but yeah. I've been thinking about Toronto because there's a lot of homeless people here, and a lot of things happening, homeless and all that, but I don't know.
Maybe Lucia could think about how to franchise, produce the Quest franchise that we
right.
could bring to Canada.
Yeah, I hope she can.
How to
That would just-
package it.
That would be just wonderful. Yeah. And also with some more people, maybe, like these people like David who can organize financial things, because that is super important to, yeah. No, it's just great. Wonderful. Thank you.
Padine, you had something to say?
Yeah, I just want, so I'm a Padine Quinn, I'm a naturopath at Quest, and I came there in 2011 because I looked at a Craigslist ad for chairs, and there was an ad for, speaking of being like led to a mission, but I had known Lucia as a neighbor, and I'd known Wendy because she's also a naturopath. But what I want to just say something to Alina, that what's so moving to me about Lucia's dream and the manifestation that is Quest now is that she started with what was in front of her, like what was right there. And she trusted and believed and started with this small step. And it's like a plant, you know, you plant this seed, and she gave it love and attention, and, you know, kept it. And there were a lot of weeds, even in the time that I came, you know, you thought, oh my gosh, there's like this drought and locusts and, you know, all kinds of things that happen. But it was faithfully administering to the growth of this being, which is Quest, and, you know, faithfully walking through and being strengthened from those hardships, I think, to be the organization that we are now, that has, you know, housing and addiction services and pain services. And so I think with the immensity of the challenges of the world right now, it's so hard to say, what can I do? How can I meet this? But I think meeting it in a small and loving and faithful way, and trusting that what is meant to grow from that will, but you're doing what you can in front of you. And I'm so happy to be part of this beautiful garden and harvest that is Quest. So thank you to all of you for your love and faithfulness, and to Lucia and Wendy, all my colleagues. My colleagues are amazing, amazing, devoted people that have given themselves to the transformation of all of the people that they come in contact with. So Quest is the real deal, and we're grateful to all of you.
Really, thank you for sharing that, because I think a lot of people ask themselves, they look at Lucia and Quest today and they say, wow, how did she do that? And it's almost discouraging because it's grown so much, but they forget that it started with one simple step, and it started with a dream, and follow through and follow through and follow through. And that 30 years later, that's what you have when you follow through. So really, it gives me goosebumps, but that is the essence of our lives, essence of our being on this earth, is that dream and the follow through and the follow through. If there are not any other questions, we would maybe ask Zafira to take us to the last leg of our journey, our last piece of our visit to Quest, and enjoy.
I started in Quest around 95, 96. And I came to Quest, I'd sobered up out of the bar community 10 years before that, approximately. But I had a partner that left me when I was getting sick. I had 18 T cells, and he left me because it scared him that I was so sick. And I came to Quest kind of on the angry side, and Quest saved my life. It was during a time when AZT was killing a lot of us because we were taking a whole lot of it, way too much. And I decided on my own to stop. like that, but I noticed that the people who were still on it were the ones that were dying the fastest, getting bone marrow transplants. And I stopped, came to Quest, and and Lucia specifically kept us alive with the different modalities they used. We were taught through hypnosis to dream about fighting our disease. And then we had a lot of other things that helped our bodies out. I got infusions of huge amounts of vitamins, and I got acupuncture, and I got shots of massage, and naturopathic help, and I got Chinese medicines.
I joined Quest when it was an experimental support group. There was about 8 to 10 guys in it all with HIV, and it was back in the 80s. My friend told me about it because there were no drugs at the time, and I didn't know what to do, and I was freaking out. And my friend Bob, who was a member of that, took me there, and I immediately became engulfed in, thanks to Lucia, in my healing process, and was also killing the HIV in my body without drugs because of Lucia and psychoneuroimmunotherapy. And pretty soon I was dreaming about just healing, and killing the virus in my body. And it got me all the way up to where there was AZT, unfortunately, which took me down several notches. And then the doctor took me off of them very quickly. And then it was Quest that was instrumental in bringing me back. I really had a hard time communicating with people and stuff. It was devastating to my I don't want to say psyche, just my intelligence level, So they worked with me with my memory and my synapses and a lot of different brain work. Definitely. Mm-hmm.
A year after I was in Subud, I was having a kind of a spiritual dilemma because I was actually more cognizant after coming to Quest and where I was in my life. And Lucia told me about Subud. And of course, Subud is an organization that doesn't really evangelize, which I appreciated because all the other religions do. And I tended to run, because it's not a religion, and told me about the Latihan and how that worked. And that sounded really enticing to me. And so I went to a help to find out about it. And I continued with the helper for almost 2 months before finally being opened. And it was magical.
I was pretty agnostic about believing in God. And when you're that sick, just in order to heal, I had to believe in first I had to believe in just the word belief. Like, I didn't understand that word to wholeheartedly put your body and soul into believing that something magic is out there. And I had to get from point A to point D in my healing process, and I didn't know what point B and point C were. I just had to believe that that this would take place, and that's when I was introduced to Subud, and it was just the perfect puzzle piece for me to have a whole existence in my community and my healing. So does that make sense? Probably not.
So my early days also were the early 80s. I was already doing therapy with Lucia and I've done on and off. I've continued with therapy, and so I did have breast cancer, and I did join Subud, and that was all about the same time in the early 80s. So it's been a tremendous support, and continues to be part of my life even now. My work with Lucia, we have, I guess you would say, my malady, if you will, has been depression and anxiety, and I really feel that I turned a corner that would not have been turned without her support, without the multitude of workshops, the psychodrama workshops, which were transformative, to say the least. As Greg said, I think when you enter a weekend with a room of strangers, and at the end of the weekend, it's as if you've known each other forever. It's a deeply intimate sharing time that I can't really compare it to anything else in my life. During that time, I was a single parent, and the divorce was a part of the process. And Subud has been, it's hard to describe really. But I would say that, it's definitely a part of me now, and I claim it, or maybe it claims me.
Inclusiveness, so I know from my part, there's so many more people there. It started with mainly gay men. And Lucia had us vote on whether, I remember this time so clearly, for the men to vote whether they wanted to include the women who had breast cancer. And it was like this overwhelming yes. Yeah, it was amazing.
But we had women with HIV that were in the group as well.
Yeah, we already had some of the women there, but they wanted to start, like a program. They wanted to bring a lot of women in, and everybody. We said, of course.
It's an organization where I always felt like when I went to the doctor or wherever I went, and I was in need of healing, people would always reach down, like, here you go, we're so sorry, take this and move along, and it's like the first time where you're like, they just bring you in and you're part of it, and you get what you need out of it. And if it's not there, they'll create it. I mean, it just feels like a magical realm for healing where you're not this victim, sick person. You are a protagonist going in to get what you need to survive and live a healthy life.
The quest for me is certainly not a job, and never has been, or I would certainly not be there at this point in my life. But I love doing the work. I love being with the people that I see and watching them be inspired or go through the struggles and feel supported. And I love working with people like Wendy, who are as committed as I am. That means a lot. It's a different way.
That's absolutely what's kept me there for so many years is the commitment and dedication and that love and spiritual aspect within the people that I work most closely with, Lucia and other people, and feeling that inspire other people or other, we have lots and lots of practitioners now who come from different places, but just knowing that there are people there who really hold that image, and Lucia having been our founder and creator and having been there for so many years, she's still the one who sees more clients or patients or whatever you call them. She sees more people every day, every week than any of us. None of us can keep up with her. We're always saying, how does Lucia do that? How does she keep doing that? And you can just see it's, we all get frustrated with things like our new electronic record program, but it's also such inspirational work, and Lucia really holds that for us so that we all can do our best with it.
Wow, amazing. I love those testimonials. Thank you. Thank you. Well, that is a beautiful way to finish up. I'm just wondering if there's any other questions that are triggered by this last sequence of interviews that Zafira carried out.
I want to say how much I appreciate Zafira and the willingness to do the interviews and then to put everything together. And it feels very moving to me to see our story. And we wouldn't be seeing it without your work and actually without the love and prayers of everybody. So thank you all, and really appreciate Zafira and Solon and all in the background.
Absolutely. I also think that when we have the success that Quest has had, we want to also start to think about how do we hand over? Where's the transition coming? And for us in Susila Dharma, this has become a really important issue to try to engage more with young people, because we have this great experience to share, and we want to inspire generations of younger people to get involved and take the same steps that Lucia and her team have taken. And so it's really very gratifying to, when a young person like Zafira steps up and says, yeah, I want to be involved. So if you know any other young people who want to be involved, we are very happy to welcome them. I'm sure Quest is ready to welcome maybe some interns or some people to learn from your experience in Susila Dharma. We also want to learn, share our learning with the young people. So thank you. And if there's any last questions, comments that you want to share, the floor is open.
I just wanted to also thank Zafira, and Samantha's here. I think she's still here. She's our future generation. She's been a recent intern who's been really wonderful to work with and is holding the torch. And we hope she comes back and works with us. But it's so wonderful to be part of an organization where you can feel that love and support when you need to be able to feel something bigger. So thank you all for holding that with us.
Thank you. Thank you and bless you. And if there are no other questions or comments, we'd like to close with a quiet and a real thanks to Lucia, to the Quest team, to Zafira for sharing this very precious moment in the midst of a real global health challenge, showing us the way that through our own efforts and working as a very solid team, that we can make change, we can create a healthier world, healthier environment for ourselves and other people. So thank you. And maybe, yes, Adam, did Adam want to say something, or someone wanted to comment before we have a quiet?